Now I want to turn to a jargon word myself, the superego. You can think of words to use for this, like an inner tyrant, a savage god, a cruel monster. But there's a bit of a problem with all these words because they suggest an individual person. Whereas in fact, I think one of the problems that people who are very disturbed, they have voices and they have injunctions, but the injunctions don't come from, as it were, a single person. They come from a sort of a consolidated group. And I think it's a very important thing in terms of the transference that normally, you've got this patient there and you're talking to the patient and you think to yourself, they're speaking about you as a person, or if they might be talking about, let's say, another psychotherapist or another man or something, and I might say to myself, they're talking about me, but it's being displaced over there onto this other person. But it's actually not correct. It's because me and the other are one. It's like an embodied group. And it's quite difficult to sort of get oneself into the sense that one is not a person. And that's one of the reasons why when the individual is persecuted and sort of threatened and pressed down and intimidated by like a savage group inside, the only thing that gets through to it is a personal statement. That gets through. It sort of, as it were, cuts underneath it. And that same patient I referred to that I saw at the Tavistock, I remember she once or twice said to me, "Is that really you saying this?" So it's sort of not quite sure. But that's what manages to undercut it. And the other thing, which is a very simple thing really, and that is that the aim of all therapy is for change and emotional development and to become self-aware. And when a patient suddenly has some sort of realization, a patient says, "I suddenly realized that all my life I've lived according to what others want of me." What's the therapist's response? Silence. That statement needs space to go in. Or a patient says, "Heavens, oh my God, I've gone about pitying myself just like my mother did." Response, silence. That you are, as it were, with the patient and just let it go in. The patient says, "I've always said it was Fred who was taken in by what anyone said, but I see now I'm just the same." Silence. These sort of moments of realization. The only thing that, other than silence, might be just sort of a comment that I realize what you've just said is extremely significant, but even that might destroy the possibility of it going in. And I just give you an example. You see, I remember someone saying, "I've always been afraid of letting myself be loved." And I was tempted to say, maybe because you fear being controlled by the one who loves you. But I didn't say it. I resisted it. It's far more important to let that realization go in. And after all, if I give that explanation, which anyhow may not be right, it's a very sort of grandiose thing to be saying, "Well, I think, it's because you may fear being controlled by the one who loves you." It's a sort of, comes from a very omnipotent place. And so it's far, far more important. It's just that sense that for that deep things need a space for them to go in. Last couple of things. Another very important thing, and I'll just try to explain the reason for this. It's necessary, usually with patients who are very disturbed, to cut out the two pronouns I and you. So, for instance, I think you felt abandoned by me when I was away last week. It's usually ineffective. But if something is said like the therapist goes away and a cloud of abandonment sets in, it can be taken in. If you say, I misunderstood you and so you despaired, it'll often churn up a furnace of sort of opposition. But if you say, a misunderstanding occurs and despair sets in, and even I can give you sort of the example, it sounds rather odd to say this. If you say, you felt depressed because I misunderstood you, it brings up this type of inner immediate opposition. And I've seen this happen where you say a depression sets in or a cloud of gloom has set in because your therapist misunderstood you. And that can be taken in, although the therapist is me. And I think there are two reasons for it. You see, if you go back to the idea that the patient who is psychotic is overburdened with a very oppressive sort of group presence, that is what is associated with the pronoun I. And so the hated I is what brings up the opposition. The other thing about it is, you see, if the therapist is able to stand outside him or herself a bit, then, and it can be taken in, whereas otherwise what is heard is, you're in this terrible state because I, the great I, abandoned.